Hello, doctor. So there's so much of noise in the social media. Daily we get lots and lots of news about artificial intelligence coming into place. No doubt there are innumerous possibilities what AI can do. With the advent of ChatGPT in December, the world has completely changed. So many people are in threat, are endangered of losing their jobs. Copywriters, web designers, app designers, even the content making has become a joke now. But can AI also replace doctors? Let me tell you a story. So there is a doctor in his OP juggling through the files. There is an inspection coming in, and there's a patient who walks into his OPD with stomach pain. So the doctor is in hurry. He wanted to scrutinize those files to complete before the inspection. So he doesn't take history properly. He hardly spends any time with the patient. The moment the patient tells about his complaints, he writes down all the investigations that has to be done and advises the patient to get them done and come back. The patient gets investigations after 2 hours. He comes back. Same, he's still busy with his file work. After seeing the reports, so and so total count elevated, CRP elevated, abdomen scan, so and so findings. He makes some diagnosis. He just tells the patient, see, these are the medications that you have got to take for another week. You'll be fine with that, and come back if it doesn't resolve. That's it. And the patient takes the prescription and he goes away. Now, what do you think? Can AI replace that doctor? 100% yes. Because he's working like a machine. What is the need for that patient to come and tell all that complaints to the doctor when he has no time even to listen? So instead, there can be AI machine sitting over there instead of the doctor. The patient or someone, a bystander or someone who's educated, maybe he can type in all the complaints, right? So the AI can analyze those complaints and tell what are the investigations that has to be done. The patient can get that done. There can be a better treatment protocol also that AI can suggest. That is exactly what is happening now. If you are a doctor who is working like a machine without proper interaction, my dear doctor, I don't know, it's high likely that you'll get replaced by AI. Because all through our formal medical training, we are taught too much about the technicalities, how to diagnose the patient, how to read the charts, how to read the reports. It's all the number game, right? How many patients are there in the ward, how many days the patient is here, since how many days the patient is suffering from so and so complaint, 8 days complaint, 5 days complaint, 101 temperature, platelet count is 1 lakh, total count is 24,000, CRP is 8, CA125 is so and so. It's all about the numbers. And we are treating the numbers, we're treating the reports, we're not treating the patients. That is why the human touch is lost. So many medical graduates are coming out with highest form of degrees, gold medals, but still they're failing in practice. Why? This is the very reason. No soft skills. They don't know how to communicate with the patient. They don't know how to hear to the patient. Very few professors iterate on the importance of communication skills. Handful of them. But most of the doctors are busy themselves in their own practices. Where do they have time to properly teach to the medicos? I'm not complaining, but this is the real scenario. This is not the same scenario 30, 40, 50 years back. Those doctors used to perform procedures better than present MS or MCH candidates. Why? Why are we not able to? We have all the degrees, but we don't have skills. So, my dear doctor, don't work like a machine. If you work like a machine, patient don't need you. One thing that AI cannot replace, the one quality that it cannot replace from humans is compassion. And patient comes to you for that one thing. He wants to be heard. He wants to be understood. He wants to get that time to express his grief, his pain. I know, you all are so busy. You got to see so many patients daily. So you can't spend that much time. What is the point in seeing so many patients, but none of them or handful of them are happy? No point, right? So focus more on quality healthcare, not quantity of healthcare. Just to write medicines, just to write investigations, you don't need to have all these degrees. That is why quacks, their practices are becoming high, because they talk to those patients. So patients rely upon them. They have to, validate to whom that patient has to go from their village or town. They ask them. Why? Because they are giving time. You don't give time. I don't give time. That is why patients are not coming to you and me. This is not how the system should work. This is not how a proper medical training has to be. If this continues, very soon doctors will be replaced by AI. I know we don't want that. So let's focus more on our communication skills. Let's focus more on that human touch. Talk to them, listen to them, show them that empathy, that you really care beyond the numbers. So my dear doctors, AI is coming in a very big way. Use AI to your advantage. All those doctors who don't use AI will be replaced. It is definitely a wonderful tool for us to, improve our productivity so that it can do all the unnecessary tasks, tedious tasks for us. So let's focus more on interacting with the patient rather than just doing the number work. All right? So I wish you all the best. God bless you.